Record. Okay. Hi everyone, this is Taher. We're on Catching Up with Taher. I'm with Allison. Allison is one of the most accomplished person in our medical class because she has written a book, and we're going to talk about that a little bit later. So, how are you doing, Allison?
I'm doing great. Thank you for having me, and I'm excited to kind of catch up and talk about what I've been up to lately.
So what have you been up to?
Of course. So I graduated with my doctorate back in June, so about 6 months ago. Following that, I actually took a position at Cedars-Sinai, which is a medical hospital in Los Angeles. And so I'm working in clinical research there. Kind of the reason why I wanted to do that is during my doctorate studies, I actually had the opportunity to work in clinical research. And more specifically, I was working on an investigational new drug trial looking at a new drug we can use for patients who stutter. So with doing that and working with patients outside of just working in the wet lab with animals, I really felt more passionate about working with people in medicine. So with that being said, I decided after graduate school, I wanted to kind of pursue a doctor of medicine. So in the meantime, prior to applying to medical school, I'm working at Cedars. I'm a clinical research coordinator. And so with that, I'm able to work with both physicians as well as patients. With this position, it's kind of unique because I'm working across specialties. So a few specialties I'm working in include urology, cardiology, and infectious disease. So it's really been expanding kind of my comfort zone since I did come from a neuroscience background, but it's been an absolute blast.
Awesome. Yeah, so I guess I introduced you wrong. I should have said Dr. Peter Allison. Um,
It's okay. You can think like a PhD is kind of a fake doctor. So.
No, you should give credit where credit's due. I mean, I attended your PhD thesis, and it was incredible.
Thank
So
you.
yeah. Um, the and so tell me a recent accomplishment that you've proud of.
Of course. So you kind of already told everyone when you introduced me, no, but it's okay. So actually one of my, besides getting my doctorate, of course, back in October of this year, so just a few months ago, while this podcast is being recorded, I actually had the opportunity to publish a book. So the book was on the clinical and basic aspects of post-traumatic epilepsy. So I published this alongside my two colleagues, my mentor, Dr. Devin Binder, and Carrie Jonak. And this was an extremely challenging project for me, particularly since my thesis work focused on temporal lobe epilepsy. I kind of had to really dive into the research field on post-traumatic epilepsy. And what's unique about this is post-traumatic epilepsy, there's a lot less we know about that than the other epilepsies. And in particular, medications that are used to treat other epilepsies aren't very effective in treating this patient population. So this is a big, hot research topic right now. And hopefully in the next couple of years, we can get some more clinical trials with these patients as well.
Hmm. So what are you planning on working on for the next few years? I guess kind of going into that,
Yeah,
where
of
do you
course.
see the research into epilepsy going?
Yeah, so most definitely. I think we've made a lot of progress in the last decade or so in epilepsy. We have a lot of different medications that can better target specific patient populations. As far as some of these genetic epilepsies we have, we're doing more like oligotherapy targets for those. So I think we'll be able to, hopefully, obviously the end goal is to cure epilepsy, right? Because what we're doing right now is we're just treating the symptoms. So with that being said, kind of what I'm doing, going to medical school, I really hope I can still be involved in that cutting edge research, and hopefully one day treat those patients as well.
Yeah, I know. Definitely you were the only person at the UCR campus using the two-photon laser. And so
Yes,
you leaving, we have like now someone has to step up and start using that. But
yes,
I do
two,
know people in the binder lab that are, continuing
yes.
your work in that. Um, and so that kind of brings me to a story. So when I was doing rotations, and I had to do a presentation on status epilepticus, and
I know it's a mouthful.
yeah, And so I had presented guidelines from like the American family the A American Academy of Family Practitioners.
Yeah.
And so I finished my presentation, and Dr. Song stood up and said, "All of the what you just said was completely wrong. We changed the guidelines like 10 years ago. What you did, what you
Yes.
presented was the guidelines for 20 years ago." So,
So,
um,
yeah, and I mean, that's the crazy thing about medicine and treatment, right? It's
mhm.
constantly adapting and changing. So something that we would have treated with 10 years ago is might be completely like a contraindication nowadays, right?
Yeah.
So as far as that's going, you just have to stay up to date on current events. It'd be great if we had some sort of resource that notified us every time something changed.
Yeah. And so this kind of brings us more to clinical research to clinic questions.
Yeah.
What would you give, what advice would you give to an emergency medicine doctor that is treating status epilepticus? Just to go over the current guidelines is usually the incorrect guideline, which I had presented is like before they used to give barbiturates, but now it's mostly focused on benzos. So
Yeah.
lorazepam is the first line to try to stop it. And so I know you did your thesis on astrocyte swelling in the brain.
Yeah.
So I don't know if you came across how lorazepam affects astrocyte swelling in the brain, or
Yeah. So I didn't. The interesting thing is, so status epilepticus is very different than, let's say, like a spontaneous seizure that someone with epilepsy might have, right?
Mhm.
So we know that status epilepticus is a medical emergency in these patients. So particularly for, let's say, medical doctors. And as a disclaimer, of course, I'm not a medical doctor, so any advice is just an opinion. But as far as the first thing they want to know is having seizures is pretty common, actually. So I believe for emergency visits in the US, about 1% to 2% of all those emergency visits are presentations of patients with seizures. So the first thing, obviously, they would want to determine if the patient is having just a regular seizure or is it actually status epilepticus. And with status epilepticus, I believe, like you said, so the current guidelines, I want to say it's benzodiazepines, right?
Mhm.
Is what they treat with. Um, which of course I believe, correct me if I'm wrong, is that contraindicated for patients that are pregnant?
Yes.
Yeah,
Yeah.
so of course you want to kind of determine if they're having status or if they're having a seizure, is that due to a disorder like epilepsy, or is it due to a secondary syndrome, such as like if they're pregnant, preeclampsia can lead to eclampsia, which causes seizures, or you want to see if it's toxins. So I think the biggest thing is in order to treat those seizures, you kind of really have to know what's happening because based on that, it's going to be different treatments. And I would say for emergency room doctors, don't forget about clinical research. For
Mhm.
any doctors in general, we need more MDs that are involved in clinical research and clinical trials, because that's really the only way we're going to be able to advance medicine.
Yeah. So I know the current class that of UCR graduates, I think about 10 of them went into emergency medicine. So
Yeah,
yeah, that's kind of also why I pose that question. And
yeah,
I also have a little bit of bias towards emergency medicine because I feel it's a little too fast and I'm more on the family medicine side.
yeah.
But that's a whole other topic.
And I think, yeah, emergency medicine's hard, right? Because you kind of have to spread yourself across all different areas.
Hmm.
So I definitely give props to those. There's a lot of emergency medicine doctors that went into residency programs from UCR, which is really interesting.
Hmm.
Um, but definitely don't forget about clinical research. That would be my take home, because I know it's really hard that bridging the gap between science and medicine, that gap still exists. And we just want to be able to better treat our patients at the end of the day. And yeah,
Yeah. Yeah, and that's also why I kind of wanted to create this podcast is because we there's kind of when you start medical school, especially at UCR, there's the biomed medical PhD students and then the doctors, and they kind of attend classes together, but then they diverge. And then,
Yeah.
your case is unique because you went the PhD route and now you want to go back and do the medicine route. And I essentially did the medicine route and now I want to go back and do the PhD route.
Yeah.
So I think it's interesting because definitely going from clinical research to actual um, medicine is a fascinating process, and there's a
Yeah.
lot of things that fall off the wayside along the
Yeah.
way. So,
I'm
just
curious if you know as well. So our this program at UCR is so unique where the PhD students take the first year classes with med students. I'm not sure if any other program exists like that, at least in the US. That would be something really interesting to look into.
Yeah, I'm pretty sure there's a couple. I definitely know that one similar programs is when you do like an MD, PhD.
Yeah.
That is kind of what a similar pathway, right?
Yeah.
And so UCR currently doesn't have that. They've
Yeah.
never been able to recruit a candidate
Yeah.
that will do an MD, PhD, but there are programs like there. And I think
Yeah.
that's what, your PI, Dr. Devin Binder, he did the MD, PhD
Yeah,
route.
but as
So
far as just a PhD student taking medical school classes, I don't know if that's very common. So,
Yeah.
which is interesting, but the nice thing is after taking those classes, if I do go to the medical school route, at least I already know the material that's covered for the first year.
Yeah, that's true. So, I guess looking 5 years down the line, and so where do you see yourself in 5 years, or what questions do you want to be
Of
working
course.
on?
5 years from now, that's a long time. If everything goes as planned, I'll probably be in my third year of medical school then. So hopefully just continuing on doing research. I know speaking to medical students, you get so caught up in just studying and getting ready for step exams. I think it's really important to also have like a hobby or passion on the side. And for me, I would say, of course, that's research and like knowing what's going on in the field of epilepsy. So I'm hoping I can still hold on to that little passion of mine throughout medical school and hopefully use that to my advantage when I start practicing.
hmm do you have any idea if you're gonna go into neurology, or are you open to other fields?
So obviously I have a little bit of a bias
Mhm.
because I've had such a good experience in neuroscience. But currently at Cedar, since I am kind of getting a taste of all these different fields, I think the best approach is kind of going into it with an open mind and kind of seeing where I fall. So I'm definitely open to other fields.
hmm and if someone wanted to contact you or pick your brain about um, epilepsy, where could they find you?
Yeah, of course. You can probably find me on LinkedIn. So if you just type in Allison Rose Peterson Phipps, you can find me there. Or you can email me at apetepipps@gmail.com. And even though I'm not a medical doctor, I do have a lot of family with epilepsy and histories of seizures. And of course, they want me to be the primary contact. So yeah, feel free to contact me and pick my brain or just chat.
hmm Well, thanks for catching up with me. I do appreciate it. Best wishes for your future endeavors, and I know I'm rooting for you, and you have a lot of supporters as well. So,
Thank you so much. Thank you for having me today.
bye.
Bye. Take care. Happy holidays.